of passing, and that's just the beginning. Senator Graham went on the record. The House bill, you've been quoted, correct me if I'm wrong, is that when it gets over here to the Senate is, quote, dead on arrival.
Absolutely.
That's what you said.
Yeah, I believe it because, number one, moderate Democrats, red state Democrats, are not going to vote for this bill in the Senate just like they didn't vote for it in the House. There was a reason that you had a 40-seat Democratic majority and the bill passed by 2 votes. Moderate Democrats, red state Democrats, ran away from this bill like it was the plague. $1 trillion of new spending, $500 billion in new taxes, $500 billion cut in Medicaid for seniors. On top of that, the government option. It was a bill written by liberals, for liberals, and moderate Democrats ran away from it like it had the swine flu. When it gets over to the Senate, it's going to meet the same fate.
It's going to die here.
It's going to die because you need 60 votes to get the bill through the Senate. Joe Lieberman has promised to filibuster with any bill that has the public option because he knows, as I know, that if you have the public option, private sector insurance companies will go out of business. Nobody can compete with the government.
Senator Lieberman, although he's an independent, caucuses with the Democrats, but he's got all the insurance companies in his state, or a lot of them, so he cares about that.
You know what he's got? He's got his ear to the ground. If this were a good deal, if this bill really did help lower cost and improve access to health care, it would have passed by more than 2 votes. There's a pattern in the House. All the liberals voted for it. 1 Republican voted for it. All moderate Democrats ran away from it because they understood what would happen when they went back home to explain this bill. Senator Lieberman just represents a way of thinking that I think is the predominant way of thinking among Republicans and moderate Democrats in the Senate. And the reason no one's challenged my analysis that it's dead on arrival is because it is.
What do you think Senator Harry Reid, the majority leader, thinks about this bill? When he must have watched Saturday night. What do you think he thinks?
He knows he's got a monster on his hand. He understands that there's not the votes for this bill. The public option, again, is a death blow to private health care choice. Do you really want to put in front of the Senate a bill that cuts Medicare by $500 billion?
Senator Nelson from Florida, I'm certain, doesn't want to do that.
No, I mean, Harry is in a bad spot. What Nancy Pelosi did, she ignored Republicans. She dealt moderate Democrats out. This was a bill written by the left, for the left, and Harry Reid is stuck with this stink of a bill. That's why it's going nowhere. There is no way a moderate Democrat, Blanche Lincoln, Bill Nelson, Mary Landrieu, Joe Lieberman, are going to vote for this bill because they can't explain it back home.
Well, will Senator Harry Reid sort of be cornered on the public option deal and take that out, and will that then
Now, this is what people need to watch. I wouldn't vote for a bill Lindsey Graham wrote in the Senate because what will happen is it passes the Senate, it has to go in conference with the House. So to any senator out there, you should not vote for a Senate bill until Nancy Pelosi promises not to put the public option in conference and the president agrees to that.
Is that going to happen?
I don't know, but
chances?
The chances are. Here's what I believe, that any bill that the Senate passes will wind up with a public option in conference with the House because that's what they want, a single-payer plan. This government option is the first step toward universal coverage and government-controlled health care. So no matter what we do in the Senate, it has to be conference with the House. And that report only requires 50 votes. You need 60 votes to pass a bill in the Senate, but once the House and the Senate compromise on a bill, all you need is 50 votes. So I'm urging every Republican and every moderate Democrat, do not vote for any bill until the Speaker of the House promises not to put the public option in the conference.
Isn't that the current plan or thinking of the Democrats?
That's the current plan.
Is that you do it without it, you get the Senate bill without the public option, you get it in conference. In conference, you put the House government option in. You only need 50 votes, and there you go.
There's the plan, and I think that plan is going to fail because really the 60th vote is the American people. The American people understand what happens with their private choice when the government gets into health care. Seniors ought to be outraged at their Medicare Advantage program they enjoy today is going to be cut by 40%. And every small business person needs to speak up and say, I can't handle any more taxes, and all these taxes are going to be passed on to the consumer. If you want this bill to stop and die, speak up, speak out, call your senator. At the end of the day, they have a plan to get it back in the bill, and that's in conference with the House. So I hope the Senate will hold firm, and next year we'll start over with something that makes sense, because what they're trying to do at the end of 2009 is to take 1/6 of the economy and turn it upside down. It won't lower cost. It won't improve private sector health care choices. It will increase cost, increase the deficit, and eventually lead to a government-run health care system for everybody. That's what's at stake. Speak up.
Up next, are some banks just flat